Hi, I'm going to provide a video for the different types of magnification available. We're going to start with the first and most common magnification, which is the direct vision loops. So obviously the key thing with these are the easiest to adapt because they're the most similar to our sight. These are quite high magnification loops, and we've also got the mag strap at the back, which is good because of lack of wires around our body, so ergonomically we can move a bit easier, but it does add extra weight, especially when you've got higher mags. So advantages, as we said, direct vision, so easiest to adapt to, negative weight, and also posture. What I found from wearing these for a period of time is that actually when you're doing a lot of work for a long period of time, you tend to lean at your hips, especially with these type of band back saddles, and you'll start to get a little bit lower back pain. So I then would recommend probably changing these unless you're just doing occasional loop work. My next type of loops I'm going to show you are the refractives. So again, these are about the highest magnification I can get. The negative about these is because we're more upright, we're looking straight now, we've got the prism giving us a different angle of view. The negative of these is that because we've got an increased distance from the patient's head, from the mouth, the magnification that we actually get prescribed is lower. This one's got a slightly different type of lighting source here. We've got a wired lighting source, so again that reduces the weight on our head, so better for long periods of time. The other advantage is that it's quite a good transition to go on something like a microscope. Again, so the posture we've got here, but again the angle is not quite coaxial. So you do get a slight little bit tipping, and we do lose a little bit of light when we're looking down into a tooth further, so if you're doing some root canal work. So moving on to the last option. The biggest issue with the microscope is the cost. So they will retail from anywhere from about 15,000 all the way up to 50,000. I think a decent scope is going to cost you around about 19 or 20,000. This is the CJ Optic Advanced Flexion, which is a pretty good, simple model. Has the advantage of coaxial light beams, you can get the highest light source, and the biggest advantage is the posture that we're going to be able to maintain here. So we should have a relaxed back, we shouldn't have any strain on our neck and or our lower back, which we can get with the different types of loops. I would say you're looking at neck strain, lower back strain with the directs. Moving on to the refractives, you might get a little bit of middle back strain, and something like this is just going to be posture and having that endurance, so obviously keeping fit, keeping it mobile, and ideally having a chair with some form of shoulder rest.